Not everything we do in surgery or in medicine in general has an evidence base, but there is strong research for a lot of what we do, particularly in shoulder and elbow surgery. As it's a relatively new and emerging field, there have been lots of recent studies that help guide how we deliver treatment, what investigations we do, and what order we should treat patients in. In shoulder and elbow, most surgeons are guided by the British Elbow and Shoulder Society, otherwise known as BESS, and they provide society guidance for some of the main conditions that we treat, such as shoulder impingement, shoulder instability, rotator cuff problems, frozen shoulder, and shoulder arthritis. And their guidance is evidence-based, and most of us who are members of the British Elbow and Shoulder Society practice along those guidelines. I use their guidance in my NHS practice and in my private practice. And I think it's important for patients that we follow the evidence base, because non-evidence-based treatments can expose patients to unnecessary risk, but also unnecessary cost. Even in private practice, cost is important, as patients often have payment limits or price limits on their contracts with their health insurers, or might have excesses that can mean that healthcare is costly for them. And so we should make sure that we're using evidence-based investigations, evidence-based outpatient treatments. We should make sure that patients have proper conservative management before considering surgery. And the surgery we do should have an evidence base behind it. And we should try to get the surgery right the first time to minimize complications and undue morbidity and costs for our patients.